And this is awesome, Miss Kate. I've not met you in person, so
Yes.
it's great that you're able to join
Yeah,
us
it's nice to
today.
meet you, Rhoda, right?
Yes,
Okay.
Rhoda. You can answer the call for me. Now, give me your phone with the agenda. Let's go ahead and just start talking. What I really wanted to do, Happy Practitioner Week first. It's so exciting. But this
Yes.
is, I think tomorrow is the last day, and a lot of people get confused about the nurse practitioner role. So I wanted us to briefly just talk about it and just have a conversation about who nurse practitioners are, what we do, how we service our community, and the history, right, of the nurse practitioner role. I know a lot of times even patients get confused because I had to correct a patient on Facebook the other day who called me doctor, and I'm like, I'm glad you enjoy your services, but I'm a nurse practitioner. And she's like, fine, I love my nurse practitioner. But I think it's an opportunity just to have a conversation and talk a little bit more so people know about nurse practitioners. So I'll go ahead and let you introduce yourself and tell everyone a little bit about you and what you do.
Sure. Well, my name is Kate Taylor. Obviously, I'm a nurse practitioner. I do have my doctorate as well. So sometimes people do use that doctor title, but there's a lot of controversy with that when we use it in an academic setting with our students. So
Mhm.
they will address us as Dr. Taylor. But our patients typically will say either sometimes they don't even know how to address you.
Right.
So usually I'll say in our clinic we have a sort of a standard of we have our students in the clinic setting call us nurse practitioner Taylor or NP Taylor, NP Kate. Some patients
Mhm.
call me Mrs. Taylor, Ms.
Mhm.
Taylor, Dr. Taylor. So but I identify my role initially and upfront and make that clear as well. But a little bit about me. I've been in nursing for, this is my 27th year of nursing. I started
Awesome.
out as the Army Nurse Corps officer, worked in the ICU for about 8 years, then went back to school for after I got out of the Army. And then I went to school for 2.5 years, got my master's degree, MSN. And then I worked in a clinic for a short stint in women's health. And then I moved back to Texas and worked as a hospitalist out in Weatherford for about 12 years, and then transitioned over to UNT Health Science Center in the Center for Older Adults, working with older adults, primary care, prevention, health promotion, and then also focusing on home-based primary care, meaning those older, vulnerable adults in their home, and then also focus on advanced care planning. And then about a year ago, I moved over to our executive leadership team with our College of Nursing and work as the assistant dean for clinical and outreach affairs.
Wow, that's such a versatile experience.
Yes, yes.
Again, it lets people know the variety of things that NPs can do, right?
Yeah.
And in the different settings, especially the house calls, you're definitely improving access to care that way. Because if patients can come to you, you're going to them to still provide quality care. So that's really amazing.
Yeah.
So tell us about your background. What did you have to do to become an NP?
Well, first you have to have your 4-year degree,
Mhm.
Bachelor's of Science of Nursing, which I did before I started as an ICU Army nurse. And then for my MSN or nurse practitioner degree, I went to school for probably about 2.5 years. And
Uh-huh.
did didactics, pathophys, pharmacology, health assessment, all of that good stuff that really advances our advanced practice skills. And
Right.
then did a whole bunch of clinical hours. I can't even remember how many I did at that time, but did several rotations
Right.
through adult health, pediatric, and women's health. And then I actually did a sort of a capstone year-long program where I worked with an internist in an outpatient clinic, and we saw it was really primarily serving the homeless population in Hawaii, downtown
Right.
Waikiki. But we also had patients who just accessed our care when they were coming over to Waikiki for vacation and needed something in terms of a health need addressed.
Mhm.
So I did that for about a year, and and then I graduated and practice. We had to practice. Excuse me. We had to pass a certification exam as well.
Oh yeah, that's very important.
Mhm. Yes. Yes.
That's key thing because the reality is, well, just like nursing, right? You can go to school for 4, 8 years and then you come out, and if you don't pass that test, you cannot practice.
Correct.
That's absolutely necessary. So the key points is the nurse practitioner role. There are two ways you can get into the role. First, you have to be a BSN. You have to have your bachelor's degrees in nursing because it's an advanced nursing role, right?
Mhm.
Then your two paths. You can have your master's and take your test and be a nurse practitioner, or you can have your doctorate and take the test and be a nurse practitioner. In your experience, what do you think is the difference between or what was the benefit for you versus just being master prepared versus doctorate prepared for your NP? Did you go
Yep.
straight
I
into your
so
doctorate program?
excuse me.
Did you go straight into your doctorate program?
Um, I would say no, or sort
Okay.
of, sort of. So
What's the starter?
I was sort of, so I started my doctorate program pretty soon after I was in working as a nurse practitioner, and I
Mhm.
did it part time. So that's why I say sort of. I strung it out for quite a long time, and then
Okay.
I did all the didactic portion, and then I had my kids, and I took about a 5 year break, and
Okay.
then I came back and I did my um, clinical component of my doctorate. So I
Yeah.
stretched it over a long period of time, which, I think it gave me some better insight on experience as a nurse practitioner before I actually completed the doctorate work.
Okay. That sounds good. That's good. So, what made you want to become an NP?
Well, I knew I wanted more in my nurse career. So, I did great work as an ICU nurse. ICU nurses are so pivotal, um, so life changing for patients. But I felt like I wanted to do it on a larger scale and really
Mm-hmm.
focus on trying to improve the lives of others as much as possible. So
Right.
I felt like I could do that in a more comprehensive manner as a nurse practitioner.
Okay. That makes sense. That's good. And thank you for your service because I know studies have shown that patients really love the care they get from nurse practitioners, right?
Mhm.
A lot of times I've heard it from both colleagues and patients about the time we spend with our patients. And I think it really makes a difference in the community. And it comes from the nursing background, right? Because typically, as nurses, we tend to spend more time with our patients. And when things come up, we notify the physicians and go from there. But once we get even into the provider role, you don't turn that off.
Mhm.
You still have those assessment skills, and you take time to spend some time with our patients, get to understand them, and really education. I hear a lot of people talk about education too, as far as NPs. Now, I understand you're also an educator. Are you? Did I hear
Yeah.
you? Yeah, I think I remember you saying that. So, as a doctorally prepared nurse practitioner, besides clinical work, you can actually do work that some people might not know to train the future of healthcare because that is so important.
Mhm.
I want to talk a little bit about the history of NPs as we get into education because I know the nurse practitioner role was really created to improve access to primary care,
Mhm.
right? I believe I remember Dr. Henry Ford. The history was, hey, we were having issues with access to care. There are not enough providers for the patients.
Mhm.
So this role was created, I think it was like the 1960s, 1967, correct me if I'm wrong.
Mhm.
Somewhere there, the first nurse practitioner program was created pretty much to train NPs to provide access to care in the primary care setting. And since then, the role has evolved because now mental health is a big deal.
Correct.
So NPs are really bridging the gap there too to provide mental health care services, primary care services, and now even specialist services, because we find NPs in cardiology, endocrinology, because we love our physicians. Let's just make it clear. It's not an anti-physician conversation, because we absolutely love the physicians we work with. The reality of the fact is we need a team, right? Because there are more patients than there are providers to service the community. So a lot of doctors to leverage nurse practitioners to expand their access to care and help them service more patients, because that's really, and it's a team approach. That's really the purpose of the NP role and how we can service others. So I see Linda is watching and Isabel is watching. Do they have the app? If they have the app, they also have the app for them to be included as the camera. Okay, so it looks like Isabel and Linda, you guys might have to join from the Facebook app so we can bring you on camera. That seems to be the problem, because I'm seeing others joining and I can bring them on camera, but for some reason, for the both of you guys, I can't bring you on camera. So hopefully, they heard and work on that. Why, I have one more question for you. And if you have any questions for me, Kate, this was meant to be a panel. We can talk to some other people. But hey, right now it's you and I due to technical difficulties. So we'll continue the conversation and go from there. So if you, I was going to pull up my agenda, and we talked a little bit about, look at me, I got the names confused, Dr. Loretta Ford and Dr. Henry Spielberg. Those were the two people who started the first nurse practitioner role. And we talked about why it was created. And we've talked about the role and training of nurse practitioners. Now we're celebrating Nurse Practitioner Week, which is a big deal, because it's time to celebrate. I don't know about you, sometimes the struggle is real. And we just get tired in servicing. And even as providers, we get tired. And so this is an opportunity just to celebrate. What would you say have been your greatest wins as a nurse practitioner? I know there've been struggles, but I want us to do some celebrations first. I have some stories about how we've helped patients, but share some stories on how you believe you really made a difference in the life of your patients. Linda, I think you have to join the app on your phone if possible. Go ahead. She just asked the question.
Gotcha. Well, that story, when you were talking about teamwork, makes me think about a success. And this happened many years ago, but I remember the story when I was working as a hospitalist. This patient came in for altered mental status, and the patient was admitted to the through the ER and then through a hospitalist service. The patient was in her room. She looked like she was sort of sleeping. She'd been like that for about a day, so, she was what we call encephalopathic. She just wasn't really awake. But then the person had been seen by the nurses, by the physicians. And when I looked at the patient and then I looked at through the chart to see what had been going on, I thought, something's missing. Something is missing here. And so I did a stat CT of her head, and she had this huge brain bleed, was actually why she was unresponsive.
Mhm.
And so it just speaks to the need for teamwork. We have to, even in team steps, they talk about having each other's back. You have to have each other's back. You have to be able to work together and put the pieces of the puzzle together
Yeah.
so we can have better patient outcomes. And
Yeah.
sure enough, she was got her over to Fort Worth and got her to a neurosurgeon, and she had the bleed taken care of, and she returned to her normal mental status.
Oh,
So
wow.
yeah, so it was a great improvement in terms of our success, and I attribute that to really teamwork. And there's Linda.
I
Yeah.
know. She figured out the text. Yay. I say nurses and tech, it's a work in progress. So welcome, Linda.
Thank you. Thank you. I'm glad to be
Yeah,
here. Yeah, I'm on
awesome.
my phone. I
Awesome.
couldn't do it on the computer for some reason.
Oh, gotcha. It's
But I've been
okay.
listening to Kate. Kate, I want you to know how fabulous Kate is. And I
Um,
wanted you to meet Rhoda because the two
Yeah.
of you are amazing nurse practitioners.
Oh, thank
So I've been
you.
bragging on Rhoda, and now I can brag on Kate.
Right?
Uh, Kate and I have been working as legislative ambassadors. That I think I told you,
Yes,
Rhoda,
you
that
did.
we were, we're trying to advocate for full practice authority,
Mhm.
and we've been doing that since when he started. We started in March. We went to the Capitol. We went to the state convention, and so we've talked to our legislator, and we've gone to a lot of meetings. So we're advocating for that because I see there's a need. I see Rhoda is an independent nurse practitioner. She owns her own clinic, and that's where we can provide services to our vulnerable population, which is, I know that's what you've been discussing.
Mhm.
And there is a basic need for access to care. And so, we're advocating for that, and whatever we can do to promote that. We have to join forces in order to be able to establish that, because how many states have already passed that? 27 states. And so, that's what we're pushing for. But
Oh,
so anyway, I know that we have an agenda,
yes.
and I know Kate's covered a lot of,
Yes.
so you were talking, Kate, so I didn't want to interrupt you. So continue, please.
well, I guess Rhoda asked me about a success, and so I shared one of mine and related to teamwork. Um, Rhoda, do you want to share something that was successful or a win in your mind for nurse practitioners?
Uh, yes, yes. And you know what? I'm gonna bring Miss Lisa on shortly, but what I wanted to talk about as Linda was talking is just to help bring context to some people with the nurse practitioner role, right? There's some states where you're limited to only working with a supervising physician, right? And I think, sometimes when you get out of school, that might definitely be valuable. But it's a legal requirement that comes into place to where sometimes in some states, NPs cannot actually service the community without a legal collaboration with a physician, right? We always collaborate with physicians because we don't know everything. I know I don't know everything. And I've been a nurse. I've been a nurse since 2007 and a nurse practitioner since 2012. And I believe there's always room to learn. Isabel, you might have to see if you can join on your phone. Linda, did you have to join
I,
on your phone to
I
come
had to
in?
join on my phone. I couldn't do it on the
Okay.
computer. You could
Okay.
not see.
So,
I could see you, but you couldn't see me. And it said send a request,
okay.
and that's how I was able to.
Okay. So, Isabel, you might have to join on your phone so we can get you on. So, but in some states, nurse practitioners are able to practice independently, right? If you work in a more restricted state, even if you're licensed, you have to find a physician who can collaborate with you on paper before you can service your community. In other states, as long as you're licensed, you can be independent and do what you have to do. I remember when I first started my practice, actually, the very first patient I saw, um, was this older gentleman who came in, and on that day we had a flood. Believe that? I don't know what pipes burst in the building we were just leasing, and we had made some calls to cancel the patients as we're trying to deal with that, right? But he didn't get the message, and he just came in because he really needed some help. And so I was like, you know what? I'm sorry, this is the state of the office, but we can help you. I can pull you to one area and I can talk to you and see how we can service you if you don't mind with everything that's going on, because that's not a conventional setting. So he was fine with it, and we talked to him, and this was his complaint. He saw blood in his urine, and he'd seen that for so long. He'd been to several urgent care centers. They'd given him antibiotics, but it's not cleared. And he was older, and he said they just told him he's going to get better. It was never really addressed. I don't know what happened, but it wasn't addressed. And obviously, we know over 50 was the first thing you think about in men when you start seeing peeing blood, right? So those alarms went off, and I'm like, okay, these are the differentials we can work on. But you've been treated for infection a few times already. It wasn't once, it was at least twice or so where he had gone and they treated him with antibiotics. So I'm like, let's do some further testing. So by the time we did he didn't have any insurance, but I convinced him, you need to get a CT. We can do the lab work, but you need to get a CT. And come to find out, he had prostate cancer. So we did the work and got him connected to resources, JPS and other places, so he could get the help he needs. And he unfortunately, he's of late right now, but he was able to we called and were able to get him into oncology, ASAP, urology. He started his treatments. We kept seeing him and supporting him throughout the process. And his family let us know when he finally succumbed to the disease. But that tells you, what if we had turned him away that day? What if we had just said, oh no, just here you go, here's some more antibiotics and go. And that's why I'm very passionate about, one, access to care, but two, quality care, compassionate care, because unfortunately the healthcare space now is where the pressure to see so many people is so high that you might not spend time with your patients, right? Or not as much time as you would like. Because nurses, we could go in and out of the room often and get to see the whole picture. But when you transition to the provider role, it gets really tough. And so you have to learn how to find the balance, but not letting go of that pause and listen, compassionate side of you has made the difference, because that was our very first patient. And look at the outcome. And we had another one that literally came to our office right after being to another clinic, and they didn't like the response they got. And they just came saying, look, I want to see if you can help me. And it was right when COVID was starting. They had never really tested her. And so I'm like, okay, this is what you've done. These are the differentials. Let's do this. Turns out she was one of the first ones with COVID, ended up at the hospital, needed oxygen and all that. And she's surviving today. We thank God for that. But just the extra time to listen and do a thorough workup. And when you don't know, ask questions, because there've also been situations where I'm not clear and I call my doctor and I'm like, hello, this is X, Y, and Z. Walk me through it, right? And I believe we should be able to collaborate without necessarily the financial and the legal structure behind it. We can work together and do what we have to do to service the community, right? And I know that's a controversial area, so we're going to try to focus on our clients. But that's just to explain to people the impact of nurse practitioners, and when done well, how it can make a difference in people's lives. And that's all we're really here to do. That's what the role was created for. And that's what we're here to do. How do we improve the access to care? How do we provide quality care? How do we provide compassionate care to the people that need it the most, right? And yeah, that's that's why I like precepting students. And I like giving new grads a chance, because how do you learn without the exposure? I really think work still has to be done on the educational side to make sure we're graduating quality NPs who are ready to really go out and serve the community. But when we're able to practice to our full capacity, right, without restrictions, because even now, one of the biggest frustrations, I guess we can go into that because that was the next on the agenda, is sometimes legally, on the federal level, I think, nurse practitioners still have issues, I think, with prescribing DME. So I have some Medicaid patients who have nowhere else to go, right? But I cannot prescribe their glucometer because the physician has to sign it. It's a blood sugar machine. I'm not giving the fentanyl. I mean, I'm not fentanyl or some controlled substance. But literally, we've had patients that only the physician has to sign it. And it doesn't make sense to me, right? But that's the structure in which we live in. And the patient gets frustrated. I'm like, I'm sorry, I've prescribed it, but unless the physician signs it, your insurance is not going to cover it. And not all payers are like that, but that's just an example. Or if something happens to our dog, we can't practice anymore.
Mm-hmm.
That's just the way it is. So.
Mm-hmm.
Oh, I have Miss Eileen Ruth. She's a FNP and Psych NP. She's watching. Eileen, if you want to get on camera and share a little bit about your story, let me know. I'll bring you on because I know you have a lot of experience too and can add to this conversation, Dr. Tayim. So you can put it in the chat if you want to get on board. So what are some other struggles that you guys have experienced in your role?
I would say I'm going to give this comment and then I have to hop off to a house call. But I would say, you know,
Okay.
I do like I said earlier, I do work with advanced care planning, and so I can talk to patients about their legal documents. I can help them. I can help get them signed with the notary or a witness, but I cannot sign the out of hospital do not resuscitate form. And so I have to search around the office and find a physician to get them to sign the document for me so we can make it legal. And that's
Mm-hmm.
just one additional step. You know, I can bill Medicare for that service. I'm competent to be able to provide guidance on that service, but I can't complete the service myself because I have to find a physician to sign the document. So for me, that's just my personal struggle with the the legal aspects of nurse practitioners and their practice and restrictions.
Right.
And we know that advanced care planning is low on the uptake. It's only about 20% of the population actually have those documents in place. And
Okay.
and we are really positioned well with our patients to be able to have these conversations, and
Mhm.
patients are willing to have these conversations, but we have a little bit of a struggle getting those documents completed. And that would be an example, the out-of-hospital DNR,
Yeah.
and now the Texas Pulse form, the portable orders for a life-sustaining treatment has to have a physician sign as well.
Yep. So
So
the beauty now we do what we have to do for our patients. So we work within the current guidelines, and yes, it ties our hands a little bit. I think when it comes to simple things, it would be nice for our hands to be untied, but we do what we have to do. You've learned workarounds, which is beautiful. So you can service your clients. So that's good. Thank you, Miss
thank you,
Kate. See
appreciate
you
it. Talk to
later.
you.
We'll get to
Bye.
meet later.
Bye.
Bye.
Thank you.
Okay, so I'm gonna see if Miss Lisa is still on. I want to hear from a patient perspective. She's not an NP, but I'm sure she's seen nurse practitioners as clinicians to get their perspective and see their thoughts. And Eileen, did you want to join the conversation? Was Isabel able to get on her phone? Eileen, if you use your phone, we can get you on. Coach K is watching. Now, people, Coach K is a nutritional coach extraordinaire, okay? I tell all my clients about her. Miss Linda, I'm going to get you to meet her because she has gems and nuggets. And yeah, it's too much to talk about, but she believes food is medicine.
It is.
So
Yeah,
yeah, it really is
I
because
believe it. Yeah.
chemicals can only take us so far, right?
Yes. And you know, speaking on food, my husband was not feeling well, and he ate a couple of oranges, and it was like a miracle where he was getting that vitamin C that he was
Mhm.
in, and the next day he's a new man. So yeah, it's critical to consume the right kind of food and
Yeah.
organic. not
Yes.
necessarily, a vitamin, but a natural food. And I'm sure your resource, what is her name?
Coach K. We
Coach
call her Coach K.
K. Coach K. Yes, can elaborate on that, how important it
Yeah,
is,
Coach
especially
K,
for,
if you want to hop on
yeah,
and talk to us a little bit about what you do and how you're changing lives. So I'm big on collaboration, right? I love collaborating with people because it just makes our job easier.
it does.
So a lot of times, even when I have weight loss patients I'm servicing, and I know I'm limited in what I can do because again, we don't have all day to spend with a patient. We would love to, but we just don't. So I would say, hey, reach out to this person. It will change your life once you just follow the directions that they're giving you and get your holistic approach to improve your health. So I like that she does a very personalized approach with her clients. It's not a one size fits all. So my prescription would not be your prescription, you know? So that's amazing. And I think that's what healthcare needs to be. Isabel, are you able to request to join me? I think Dr. Payim says what in about 5 minutes she wants to hop on. So that's good. Miss Lisa, are you on? Let me see if I can get you on because I wanted to have her on camera. Um, uh,
Okay, while you're working on that, Rhoda,
Go
I
ahead.
didn't really introduce
Oh
myself. Uh,
yeah, please go ahead.
so
Sorry, I know we
yeah,
just started
yeah,
talking.
go ahead and what you're trying to work through. So just a little bit about myself. Um, I climbed through the ranks. I started out from the very bottom. As a nurse's aide, I became an LVN,
Mm-hmm.
and then I decided, okay, well, I was able to accomplish that, and then I went on to become an RN. I went to UTA, got my Bachelor of Science in Nursing, and then I thought, well, I can get a master's. So
Yeah.
I think education is very important.
Mm-hmm.
So I started working for the school district right as soon as I graduated. They hired me on the spot. And so I worked there and I saw that how vulnerable the children were, and they didn't have a primary care physician or a pediatrician to look after them. And so I
Mm-hmm.
saw there was a void, there was lacking in that area. And I saw so many children, and not only the children, I saw the adults as well, because teachers, staff,
Yeah.
cafeteria employees, janitors, the principal would come to me. Will you check my blood pressure? Will you check
Yes.
my, will you, I don't feel well. Do I have pink eye? And I felt very limited at that time
Mm-hmm.
because I couldn't diagnose, I couldn't treat. All I could do is make recommendations.
Yeah.
Go see your doctor. Go. Try this. But I could not treat, or I couldn't diagnose. So the next step was to look at the doctorate program. So I wasn't sure whether I wanted to do a PhD or I wanted to do a doctorate as a nurse practitioner. And so when I saw that there was a big void in getting access to care to a lot of different populations, especially because I worked in an area where there was primarily low socioeconomic families
Yeah.
that didn't have access to food, didn't have access to utilities,
Right.
couldn't pay their rent. And so I was always looking for resources to help them. And so I thought, well, how else can I help them?
Right.
Getting the medical part. And so then I went on and got my doctorate as a nurse practitioner at Texas Wesleyan. And I thought, well, that completes my education part because that's the term of the degree, right?
Yeah.
And so I thought, well, this is a way to give back to the community. And I
Mm-hmm.
still want to give back to the community. And so when I found you, Rhoda, I thought, wow, that was a godsend. That
Oh,
was a godsend. I'm telling you, that's divine intervention.
yeah.
And so I see that you're doing all of that. And in your clinic, you're providing services to people that need assistance in whatever financial, they need referrals, they need holistic care, they need somebody to follow up with their care. And that's why that is the right place for me. And so being able to work with you, and you as a teacher, you're so awesome in how you
Thank
talk to
you.
the patients. I mean, you spend so much time. I've never seen anybody spend so much time with patients as you, and you explain
Thank you. Thank
everything,
you.
and you cover everything.
Yeah.
And that's what nurse practitioners are all about, is
Mhm.
like you said, holistic care. And so you're covering everything. And
Yeah.
so, and you leave it to where, do you have any questions? And
Right.
never feel rushed. The patient never feels rushed. And so that's what I like about your clinic. Just, and then the fact that you are so independent, and you know when to consult a physician, and when you make decisions on your own.
Right. Look at you're on my stuff here, so see if you can add the other
Not gonna let
info.
it since it's not gonna let us do it.
Oh, from there.
Yeah, it's probably gonna be
Okay. Um, you know, people always ask me why I spend time with their patients. I have patients who drive over an hour to come to us, and when I see the sacrifice that they're putting to get there, I feel like I just need to see what I can do to help you right now, right? That's one thing. But I also really believe that if we empower our patients to make better decisions about their care, um, teach them why we want them to make the change, and then give them the tools to make the change, they are more likely to be successful, right? I could tell, like a diabetic patient, for example, I can tell them all day, change your diet, change your this, take this medicine, take this medicine. But if they don't really understand the disease and why it can cause so much damage to their bodies and why it's important to make those changes, I can prescribe it all day. They'll never listen and they'll never follow through. So now we're wasting each other's time, right? And so I feel like if I tell you, obviously I cannot make you do anything, right? All I can do is give you the tools. This is what this disease does to you. This is what you can do to change it. This is why I think you should change it. What is your goal behind trying to be healthy, right? And there's some patients that we just have to meet them where they are. If they're really resource limited and cannot get the right foods, and because we've connected some of them with food banks and stuff like that, because people are struggling out here, right? And
Right.
I'm like, okay, in this season, you need insulin. I'm not telling you you're going to need it forever, but this lifestyle is causing these sugars to be this much, and we need to change it, right? I know it's not an overnight journey to go from a highly processed food. I need to empower you as much as possible to do that. But this is where you are right now. And these are what your numbers are telling me. This is what I can offer you to help improve your numbers right now. And as you make the changes, we can wean stuff off, right? But you have, and I've had patients who say they absolutely wouldn't, insulin, for example, wouldn't do it. That's okay. This is, if it's deadly and I tell them why we're needing it, if they're so high, it's still your choice. It's your body, is your choice. I can prescribe it all day, but if you're not willing to take it, there's nothing we can do. What are you willing to do? So I can partner with you where you are right now so you can get your best results. And sometimes when they do X, Y, and Z and it's not working, then they come back and say, okay, I'm ready to try this. But when they try the exercise and they try the dietary changes and realize, oh, this is actually working. Because sometimes they say, we've done everything we can do, nothing is working. And I'm like, okay, let's discuss. What have you done? Right? Are you open to meeting with a nutritional coach to help you? Just don't give up. And a lot of times they might have given up on themselves. If we give up on them as well, it's just not a good place, for lack of a better word. So that's just why. What made me get into NP really was just like you being in the ER. I started at JPS, so we worked observation. We saw patients come to the ER, and I'm like, you know, if we had managed your high blood pressure a little bit better, you would not be in heart failure right now. If you had managed your diabetes a little bit better, you wouldn't be here for dialysis or kidney failure. Now I understand things happen, right? There's always exceptions to rules, but most of the time, if we can prevent these things from happening, guess what? We can prevent the terminal outcomes that come from it or the end organ damage that comes from it. And how many times have we seen patients? So I don't know why I'm taking this medicine. Oh, they didn't even tell me my blood sugars were high. They don't know. Somebody just prescribes and they go take, or they don't take because they don't know what it's for. And so you've practiced with me. So a lot of times, sometimes I'll ask, why do you think you're taking this medicine? And they might not know because they're just taking something. And without that, information is power. If they don't have the information they need to make the right choices, they might stop taking it. I had a patient in pain, and I'm like, you have pain medicine. She didn't know that's what it was for. And so you've been suffering just because you didn't have the information you need. Okay. Where Dr. Tayim, for some reason, it's
Tell
not
her
letting me add
she
you.
needs to go download the app on her phone.
Oh, it says you need to download the Facebook app on your phone, dear. If it's on your computer, it's not gonna let
Yeah,
us
it's not working
join.
on the computer. It has to be
Oh
through.
yeah, there it is. It tells me to bring her on camera.
Oh,
Okay, so it's adding her. So, oh, Coach K is on there. Let me see if it'll let me. Oh, I can't. Coach K, I cannot add you as a. I can't add you as a.
Sorry, I don't know.
It says she can't join due to technical issues. That's okay. What happened to Dr. Tayyip? Isabel. Isabel is another nurse practitioner with her own practice on the other side of Fort Worth. She's on her phone. I know I just requested to have you join Eileen. There we go. What just happened? Oh, there we go. Eileen Tayyip, add. It's gonna try to add you right now. I sent you a request. There
there,
she goes.
there she is.
Hi.
Dr. Payim is psych and NP. So you're here to
Yes.
put all our mind, right?
She's on the move too.
After we work our stress, that's who we go to.
Thank you so much. I've really enjoyed the conversation,
Oh, you're welcome,
Yeah.
dear. You're welcome.
Yes.
Talk about yourself. I
Lucky.
think we've all introduced ourselves.
Okay. Hi, I'm Eileen. I'm Psych NP. I'm actually dual
Yes.
certified. I'm a family and a Psych NP.
Mhm,
And I have a clinic in Allentown. It's called Meriba Clinic. I practice with 3 other nurse practitioners.
mhm.
So I started the clinic in 2022 and 2021. And when I started the clinic in 2022, I was a preceptor for 2 NPs. And when they graduated, I actually just hired them right out of school. So they've been with me since they graduated and they trained with me for over a year. And then last year, we brought on another Psych NP. Her name is Tamoya. She's been awesome. So right now, we have 4 Psych NPs at the clinic.
Awesome. Talk about access to care, girl. Go ahead.
So it's been a pleasure. It's been awesome. Where we are right now in Allentown, there is a wait list of 3 to 6 months to get into see Psych.
Mhm.
So the clinic has, really, really made a lot of, changes. We had to, really work hard because we are the only practice in Allentown that has nurse practitioners. Most practices are physician owned and they hire NPs to work with them. So the clinic is the only one in the area that has 4 NPs. So it took a while to get our name out there and educate because a lot of people were like, so who is the who is the psychiatrist? And we are like, we have a collaborator. We actually have 2 because in Pennsylvania you need 2 collaborating psychiatrists. Yeah. So interestingly, they don't have to sign anything. They don't have to review charts. There is really no documentation that is required by the state. But when you do the paperwork, you need to show that you have 2 collaborating providers.
Yeah.
So that has been interesting. And the 2 that we have, we've had them since the clinic was opened. They are very friendly. We don't really interact much, honestly, because between all 4 of us, we collaborate. We have a strong relationship. We reach out to each other. And being that I trained, the 2 NPs that work with me now trained with me, they know they can trust me and they can come with me with any cases. So we just review together.
Yeah.
And we meet like bi-weekly and just review if there is an interesting patient on your caseload you want to talk about, if you want counsel. And then on a daily basis, we have our WhatsApp group. And if you're just struggling, you reach out right there and you get responses from all of us.
Gotcha.
Yeah.
That's interesting. So it's a WhatsApp group for the patients or the staff?
No. It's a WhatsApp group for just the NPs in the clinic.
Okay, that's good.
So if
Support
you're
each other.
seeing a patient or if you're seeing a patient, let's say in 2 hours, and you're reviewing the chart for the intake, you can just put it right there, like 16-year-old has tried this meds, is coming to us. And then right there, you can get at least 3 other responses. Yeah. Because we are 4 NPs, all of us were in the clinic and in the group. So it has been such a good support for everyone because we're constantly growing and constantly learning. So even now and then I would put on a case there and I'm like, I'm seeing this patient, this is what I've tried. And I get feedback from everyone.
Gotcha. Teamwork. My mom used to say, teamwork makes the dream work.
Exactly. The teamwork has been so good. And we are, we're growing. We're growing. Everyone seems happy. We all have our panel of patients and it's been good.
That's good. That's phenomenal. So thank you for sharing, because I really wanted patients to know what NPs do, but NPs to know what they can do, right? Because if we're really here to serve, there are always ways you can collaborate together to serve the community, right?
Correct.
And collaborating is not just unilateral. As far as collaborating just with NPs, we collaborate with our physicians, we collaborate with our medical assistants, we collaborate with our nurses, we collaborate with physical therapy. It's a healthcare ecosystem, right?
Exactly.
And so we have to work together to optimize access for our patients so they get what they need. So that's phenomenal. What has been your challenge? What challenges have you faced, Eileen, with your role as an NP and then as an entrepreneur?
So as an NP, we work very closely with therapists. And sometimes patients do not really understand the difference between a provider and a therapist.
Right.
So, and sometimes therapists do not know the boundaries in care.
Right.
So to give you an example, one of the challenges that I face on a frequent basis is when a therapist would tell a patient, you have ADHD, go see your provider for medication. So the patient is coming to me and they already have an idea on a diagnosis which a therapist has given them without confirmation from a provider.
Right.
And when they come, they're like, my therapist says I have ADHD and I'm here for you to give me a stimulant. So when you do your own assessment, you're like, I'm not sure if you have ADHD because your PHQ now, your depression scores are really high. You're admitting you have suicidal thoughts. And right now the priority is to stabilize your mood.
Right.
And they're like, but my therapist says that I have ADHD and what I need is Adderall.
Yeah.
So so now you reach out to the therapist and coordinate and try to just get some feedback as to how they came up with that assessment, and then work as a team to let the patient know that mood is always a priority before we assess for ADHD. And if you're struggling with depression and active suicidal thoughts, that's really where we need to start treatment.
Yes.
So that has been, part of the frustration, even talking with my colleagues are like, I'm seeing the patient, their therapist has already told them this, and now we have to re-educate.
Yes. And it becomes harder because the 9 times out of 10 they build trust with that therapist, right? And so they just believe that's their diagnosis, not understanding that there is an evaluation that has to happen before we come to this point. And so now you have to do the work of debunking those beliefs and then build trust with them, right? So that they can go through the assessment, believe the assessment, and be willing to let you help them. Meanwhile,
Exactly,
I mean,
because like you rightly stated, patients are seeing therapists on a weekly, sometimes twice a week basis. So there is already a rapport and a trust which has been built with the therapist prior to coming to you. And the therapist word is gold. So you have to be careful how you phrase it, because you don't also want to just say, oh, she's not qualified to make that diagnosis. You have to be careful because they have a rapport which has been built with this therapist, and so you don't want to attack the therapist assessment.
And they're providing a valuable service too. Sorry, go ahead.
Exactly. So it's a little, you have to be technical, try to talk to the patient. And then I have found that when I reach out to the therapist and also share my assessments with them, they are very, very, very receptive, and they do not mind even meeting with the patient and saying, this is what I spoke to Eileen, these are her assessments, and this is what she's thinking. This is where she believes your priority is at this time. So there is a lot of collaboration with that.
Yeah. And again, I think that's why we have conversations like this, because sometimes patients just don't know and don't understand. I've had clients that I've had to say, obviously, studies show pharmacologic therapy and talk therapy, or the therapy through the counselor and meds work best together, right? So just taking meds without therapy, you'll get some benefit, or therapy without meds, you might get some benefit. But a holistic approach from a nutritional, pharmaceutical, and clinical approach is necessary for the patient sometimes. So I always tell them, psych in my role, I know where to refer you. I can do the basic assessments. And I'm also very careful about starting meds without that psych eval, because I know that's also a struggle sometimes with psych and FNP, right? Because if you don't do the full assessment, I know there's some meds that can exacerbate moods, right? Or exacerbate anxiety. And I'm like, the best thing for you right now is go see this professional who can do a full assessment. So we're making an informed decision and not just treating what you think you have and trying to put a band-aid on a gushing wound just because you want answers right now. So if we have these conversations and educate the community on the importance of an evaluation, let's start from there. And we already know we're resource limited. Even with all the psych NPs coming out right now, there's the ratio of provider to patient, as far as mental health is concerned, it's still not balanced. So
that's true.
Yes, you might wait a year to see a psychiatrist, but you can see a psych NP who is also trained to help you with some of those things, and you can get some solutions or answers faster. Because
that is correct.
Yeah, it's just the way the healthcare works. That's why we're here, to provide more access to care. So that's phenomenal. Thank you, thank you.
You're welcome.
Oh, sure. You just hopped on and joined the conversation like you came ready for it.
Yeah, this is really, really awesome. It's awesome. I'm excited. It's Nurse Practitioner Week. Happy Nurse Practitioner.
I know. Thank you. And that's why Linda and I were in the office on Thursday, and she was like, "Oh, let's take a picture for Nurse Practitioner Week and stuff like that." It's really her first week starting with us.
Okay.
So we did. I'm like, you know what? Let's have a conversation How about we go live? One of these tomorrow. We're gonna do it yesterday, but we didn't get around to. And just have a conversation educating people about NPs. Because how many times do I always introduce myself as a nurse practitioner?
Mhm.
Some people come prepared because they already know, and some others, who are nurse practitioners? What do they do again? And they just don't know. So this is one way of educating them. I was gonna see if one of ooh, Dr. Ola, she's on there. Hey, Doc, if you want to hop on and tell us your experience working with NPs and show us some love. I know you show me love on the back end, but you know, we could get you on camera here. And then I wanted to bring on one of client and see what their experience, just sharing their experience. Share the stuff, trying to add some people that patients that put can ask patients. Yes, if there are any patients here who have questions or want to share their experiences working with nurse practitioners, you can come on board. And okay, I was trying to bring Miss Lisa on, who has been on before, but she's not able. It looks like she's having technical difficulties. But it's been about an hour. So Miss Isabel, I'm so Eileen, how were you able to get on? Because I really wanted Isabel to get on and share her stuff.
I think you sent me like a link, and then I had to click on it and join.
Okay, but you're on your phone, right?
Correct. I'm doing it from my phone.
So I don't know, Miss Isabel, I know we're gonna hop off soon, but you've been on this whole time. If you're able to, she's an NP here in Dallas too. If you're able to get on your phone and join as a viewer on your phone, I can add you to the camera to share your story. And that would help. And then Miss Imhil here. I'm trying to make sure I've not missed any conversations. I was trying to add my coach extraordinaire, but it's not letting me add. Man, look, she's the nutritional coach. When I tell you she's making a difference out here in the streets, it helps. Thank you, Dr. Ola. Happy MP week. She's been wishing me happy MP week. Okay, so anything else you guys want to add? Isabel is not answering, so I think it's been about an hour, right? So we're gonna go ahead and hop on. And you know, this has been fun. Maybe we need to do this more often.
We should.
Definitely.
Yeah.
Definitely. I think it's a great idea.
Yeah.
Yeah, and I think what we need to do is talk about, I know all of us got into healthcare more for preventive medicine to help our clients. So dropping gems on what we can do or what they can do to actually improve their health, right? In different ways. Preventive medicine, what are little tips you can do to help you? Because there's so many things that patients just don't know that they can do to improve their health, but also how to facilitate their connection with their providers. Like Eileen, some of the clients who come with you or to you already preset saying, I want this. If we could teach you a little bit that, look, come with an open mind. Dr. Google may have given you some tips.
Exactly.
But
Exactly.
Dr. Google didn't go to school for 6 years or
That's
seven
true.
in some cases. So come with an open mind, come prepared, come with your questions, and let us help you and give you evidence-based solutions to your problem, you know? So that's good, that's good. I don't see Miss Isabel, so I might have to just connect with her on the next time. So 2 minutes, I'll let everybody go through real quick, say their final thoughts and one advice for the community, so celebration, and we'll hop off. Linda, you can start. You've not really said anything in a little while.
Okay. Well, again, this was a perfect opportunity to be able to discuss what NPs do and clarify some of our roles are expanding. You know, there's many nurses that are working independently now, autonomously, and we promote, you know, preventative medicine, and we are highly available for the most part. We just need to be able to expand our role as a nurse practitioner to our full potential, which was what we're trained to do within our scope of practice. And we need to market ourselves more. And I think that because that we were registered nurses first, we always worked under the direction of a physician. We're pretty reluctant to go out and market ourselves and promote ourselves, and we need to do more of that. We are humble, and but we need to be more outspoken and say this is what we do, and we're here for the patient. We're here to provide those services and fill that void, that need that is out there, and I think patients will appreciate that.
That's so true. As a rule of thumb, women and nurses, well, women really in general, we're not as good as talking about ourselves and what we do, right?
Right.
Selling ourselves as where, even though we provide valuable service,
Right.
So this is a good opportunity to do that. All right, Dr. Tayyam. One
Wow.
piece of advice for us and then your clients.
So one advice for NPs is, keep growing. Keep growing. Yes, do not, I'm constantly reading, I'm constantly doing research, I'm constantly reviewing articles. I believe that, to continue to provide evidence-based care,
Yes.
you really need to keep growing. So don't relax. I was thinking about this the other day, like I've been doing this for 10 years, but I still have my books and my research, and I'm still, going because NPs, a lot of people do not understand what we do and the services we provide. And I believe that you will do yourself a disservice if you do not bring your best when you are working with a patient. I remember starting the clinic a few years ago, and it was not only was I African with an accent, and now I had a clinic in Royal, Pennsylvania. So I had to really work hard and bring my best every day to work to get my reputation out in the community. So now we are 4 in the practice, and I tell my providers all the time, I say, please keep growing. Bring your best to work every day. We are 4 outstanding women, and we are very proud that we are 4 outstanding nurse practitioners to work together.
Right.
And, we are constantly just saying, bring your best.
Yes.
So that's my advice to fellow NPs, please keep growing, please do not settle, and always, bring your best when you come to work.
Yeah.
What was the next question? What was the second part?
Well, no, and then anything for your clients or patients.
So for the clients and patients, a lot of times you don't understand what an NP can do for you. So my advice to clients is to keep an open mind. I've had clients who have had a trauma experience with other providers. So when they come to see me, there are barriers to communication which we have to work on before some rapport is established.
Right.
And in my role as a psych NP, we are dealing with mental health, we're dealing with substance abuse. So it's a little different, And there is some empathy, extra empathy when you're communicating with patients who are, who have mental health issues. And a lot of times you're dealing with patients that have trauma experiences from growing up, from working with other providers, from being judged, especially when they have a substance abuse history, They're already telling you, like, I use drugs. I know you think I'm here for benzos. That's not why I'm here. So I just told myself, listen, please have an open mind. There are no preconceived ideas. There is no judgment. This is a safe space for you. And I tell that to my patients, that I'm not here to judge you. I'm here to support you.
Right. That's right.
And I believe that when you're empathetic and you communicate that to patients, they are really, they start to relax. You can see them beginning to relax. And I tell them, this honestly is a safe space. I really want you to understand that.
Yes, 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 yes. Safe space, and we're here to serve you.
Yes.
Thank you, thank you, thank you so much.